Now let's dive in. So let's start with telling the audience what exactly is intensive short-term dynamic psychotherapy, and then we'll just flow from there. But let's give them an idea of what exactly is your expertise and specialty.
So, I mean, the first thing I want to say is, I was in the same training program as you, and I also found ISTDP to be, it's the most compelling of because in training we get exposed to lots of different therapy modalities. We learn basic supportive therapy. We learn about the CBTs. You get exposure to the ideas of psychodynamic psychotherapy. But ISTDP was it's the most pointed, it's the most clear, I think. And it seemed like it had the most promise.
When I started with my ISTDP training, it was that finally, aha, this is what I have been searching for in my psychiatry residency. This is what I need to learn to look at people and just kind of see what's going on. How do I solve this puzzle? How do I analyze people? What is giving me this special lens of analyzing someone, if you want to call it analysis, we'll get into that, that like the other therapy modalities don't give you.
It gives you such a structure for that. And like that reminds me of when I had that same feeling. I was like, it's like this aha moment. When they start explaining it, when you see the video and you see it in practice, it's like, this is when I was like a teenager and I was before med school and I was like, struggling in my life. And I thought, supposedly there's this thing called therapy out there and it helps people. And you imagine, well, how might it help people? It's going to show me about these parts of myself that I don't know. It's going to, reveal the patterns of how I'm getting in my own way and screwing my life up. Yeah. Like that's what it is what you imagine therapy to be. It's the closest that you're going to get to it.
Absolutely.
I really think so.
Now let's break it down, if you could, for the audience, the I, the S. Talk to me about what does it mean and what is so intense about this? Yes.
Yeah, I guess you really should start with the intense part because actually, I thought that therapy would really help you figure out the patterns and stuff in your life when I was young. But as you get to know therapy later on, it's actually much more gentle, because you think about these patterns. If you want someone's life to get better, they have to change. And change is hard. Yes. And it will always be painful. Yes. Because growth is about being different than what you are. And being different is always the easiest thing. I mean, being the same is always the easiest thing to do. So being different is going to be hard to do. So that's, the stance of ISTDP is that you can be different. So if there's part of the intensity comes from, for example, if you're talking to a patient who's very anxious all the time, or if they have like a history of depression, especially with depression, most people, it happens to them and they have no idea why, and it's really easy to just say, well, I guess I am depressed and this is just how I always was. But ISTDP at the very outset takes the stance that no, there is a cause and you can figure out what it is and you can change, and that can be a lot for people, especially for someone who's depressed at the beginning, because part of being depressed is feeling like you really can't do anything. Depression oftentimes is a really hopeless, helpless kind of position that you find yourself in. And I don't think that people who are depressed are choosing to do that, I think it's something that happens because of a whole complex set of factors in their life that leads to them feeling helpless and hopeless and like, this is just what I am, for some reason I just always am kind of glum and, when things are supposed to help me feel better, it just doesn't work, So it's hard in the depressed position to feel like you can do that. But ISTDP is it's about actually changing your life. And so it wants to give you the power to do that.
And so several things of what you just said. So first of all, making change is possible. Two,
yes,
ruling out any sort of medical cause. No one is depressed for no reason.
Right.
Now, if you have a genetic predisposition, okay. But when patients come in to me and ask me, I always say no one is depressed for no reason.
Yeah, it's not like the flu, it's not like it just happens. And you're like, I don't know. Even the flu has a reason, right?
Exactly.
But it's a reason outside of you.
Yeah, you might not be consciously aware of why. But no one gets depressed for no reason. Now, one thing I want to bring up a little bit later is bipolar disorder and the occurrences of depressive episodes there and whether or not that follows the same principle that you just mentioned. We'll get to that a little bit later. So change is possible. No one is depressed for no reason. And importantly, making change and lifting yourself out of repetitive self-defeating patterns and depression is difficult and can be painful. Staying the same is more comfortable now, but if you want to quantify pain over time, if you are depressed, then staying the same, although more comfortable now, is going to lead to long-term symptoms.
There's an automaticness to the comfort, you know, of being in like an anxious position or being in a depressed position. You know, if it's something that a person has been doing habitually, oftentimes since childhood, you know, in reaction to stressors and stuff, then it seems on this superficial level like it's easier. But actually, if you think about the effort, once you break free from the depression, you'll realize that like actually you were doing a lot of work to keep yourself down.
Yes.
You know, that's kind of this untold secret of depression. It's like depression is a lot of work. It's whenever something happens that might lift up some sort of feelings inside you, whether, you know, it's something that triggers a spark of anger or something. For some people, they'll get depressed when something happy happens, you know, because they're not okay with their happy feelings, or if they're not okay with their sad feelings. Like a feeling comes in order to redirect that energy, you have to do something, because the natural thing to do would be to experience the energy and then to have a satisfaction from your feeling. But what the depressed mind will do is it will take that feeling and it will become really in conflict with it. It's not okay that I get happy right now. Someone might see that I would smile and then they're going to try to take my happiness away or something like that. You know.
Well, you're saying depression takes a lot of work. Now, so I want you to expand more on what staying depressed takes a lot of work.
Yeah.
And what you just described as far as these uncomfortable feelings or feelings coming up, like, is that happening consciously, unconsciously? So what do you mean by staying depressed takes a lot of work? That's very interesting to me.
Yeah. Okay. And I think a lot of this,
and if you could throw in any sort of examples and make this more clear for me and the audience.
Yeah, because I think the preliminary idea that you have to understand is that there's a lot that's going on inside anyone's mind unconsciously. You know, like just as an example of one of the moments when I really noticed the unconscious was I was in a training for actually ACT, which is, you know, it's a type of therapy where it's a lot of mindfulness and paying attention to yourself. And they passed around a little box of raisins, and everybody slowly ate the raisin.
I remember that one.
You remember that one?
Yeah.
And so then the supervisor there, he was like, okay, now just let the raisins sit in your mouth. I'm letting the raisins sit in my mouth. And he's like, now chew the raisin slowly. And chew. And then after that, there's like the little raisin and it's like stuck on your teeth. And like, you know, the tongue, like my tongue, I imagine most people's tongues, just automatically starts like scraping the leftover bits of raisin off your teeth with no one watching, you know, with your mouth closed. And the supervisor, he said he brought that to mind. He was like, now notice that's what your tongue is doing. It's cleaning the stuff off the teeth. And I thought, I've been doing this my whole life. Every time I eat anything, you know, and I'm not thinking about it.
Yes.
You know, I'm not like sitting down at the table, you know, having conversation with friends, like eating, you know, my pizza or my pudding or whatever it is, and thinking, and now I'm going to scrape off the stuff from my teeth. I don't think that. It's not conscious. I just do it, you know? So that's a good example of how the unconscious is always at work in your life. You know, it's in this example, it's sort of cleaning off the debris from your teeth to try to keep your mouth clean. So if you grew up in a situation where your parents or like your older siblings or something are like, whenever they see you happy, they can't take it. You know, maybe they're not okay with it. Maybe it's an older sibling who's got like a competition, like a, you know, like a sibling rivalry kind of a complex. And so every time they see you like having won or having succeeded or like being happy and wanting to dance around, they start cutting you down and stuff. Eventually you learn like, oh, okay, this is like a dirty raisin on my teeth. I need to clean that off. And you're not doing this. You're not doing this consciously. It could be deemed
unacceptable.
Yeah, exactly. It's like we don't want anyone to see the raisin. So but you're not doing this on purpose, right? You just want clean teeth, and it feels unclean because your older sibling is just always like laying into you, right? And so the way that the depression might develop in that situation is the next time that you're about to get a happy feeling, like you feel it in your body unconsciously.
Yes.
And then your body immediately is like, there's raisins on my teeth, you know, metaphorically.
Yes.
And so then it needs to start cleaning the raisins off. And this is how you do the work to be depressed. And here's what the work is. It takes that energy and it starts thinking of what else, literally, is there anything else I can do? And what the depressed mind oftentimes does is it seems rational, but it pushes it to the point of irrationally. It starts trying to figure out reasons why you're not happy.
Fascinating.
So it's like,
being happy growing up from attachment figures, siblings was deemed unacceptable. When you were happy growing up, you were cut down.
Right.
Now this is unacceptable. Now as an adult, these happy feelings come up unconsciously, that you've recognized that this is unacceptable and some sort of threat to me.
Exactly.
And so to defend or to
stop it from happening,
to stop that from happening because it's unacceptable, you start doing the work of all the reasons that I'm not happy.
Exactly.
Okay.
And these thoughts, they come up automatically, you know, and you're not planning to do this. Like, this is not something, but ISTDP takes the stance that I know you're not planning to do it, but fortunately it is something that if you notice it, like noticing the rays in your teeth, now you have some control over it.
Okay.
You can choose what to do.
Okay.
Know? So it brings it to your attention to say, look, you don't need to start analyzing me and like, look, I know I was about to say like, oh, it's just, sure, I won that competition, but I had a lot of help from my friends and, really my teacher, they gave me the outline. And so it's not really my work, Like, these are all thoughts that will make you feel depressed. Right. Yeah. And for the depressive person, they come up automatically, sometimes they come up so fast that like, you don't even notice the whole thought. You just get a flash of almost like intuition. Like the intuition that like, oh, my win wasn't really that big of a win.
Yeah.
Yeah. And if you think about doing that 24/7, your whole life, like that's a lot of work.
Absolutely.
Where this came from. You're like, it's, over time, it seems like it's going to be, it seems like it's a lot of work to change it now. And it is. But over time, you're going to be doing so much work just to keep yourself depressed. And you're going to be doing it automatically. You feel like it's out of your control.
But it's still cognitive work. Now, correct me if I'm wrong, but like I think studies show, like fMRI, that the depressed brain is working and consuming more glucose and sugar than the non-depressed brain. So when you say work, the brain is actually literally in overdrive in the depressed patient, rather than the non-depressed patient.
Well, if you have felt like we're working with happy feelings right now. If you felt a happy feeling, like a happy feeling it's a big feeling, It's like you see people are happy on movies that really nail it at the end. They always put like a dance party if it's like a happy ending. Yeah. Why? Because when you're happy, you want to get up and play and jump around and dance. Like that's all emotions, they have motion in them, right? They're emotions. So the motion of the happy feeling is to play and to jump and to dance, right? The motion of the angry feeling, of course, is to like lash out and to strike and to destroy, right? So like there's always like an emotion, there's always a motion to the feeling.
Yeah.
And like there's so much motion that you want with a happy feeling. Like your brain's got to be working on overdrive to cut that down.
Absolutely. And
that's the work.
And I think part of what you do is get people in touch with their feelings.
Yes.
Now, I recall learning like the several components that are part of being in touch with one's feelings. Naming what the emotion and feeling is, how it's changing the state of your body. I'm angry, I'm hot, my fists are clenched. Yeah. What is the behavioral impulse associated with the feeling? Who is this feeling directed to? Now, this is one bit of the ISTDP training that I take with my therapy patients, is getting people in touch with their feelings.
Yeah. No, and that's I think the original question we started with was, what is ISTDP? Yeah. And if I were really to break it down into like two simple pieces, like here's the two main parts of ISTDP. One of those parts is exactly what you're saying. It's helping people to actually experience the things that are going on in their body. Because the depressed person, the very classically depressed people, they don't even, like once they're deep into it, they're not even getting a flash of anger anymore. Like something happens that makes them angry and then immediately they shut down. You know? They're already like analyzing and rationalizing why the other person's, causing problems and why they're they failed and stuff like that.
Or they skip anger and go straight to anxiety, but we'll get there in a second.
That happens too, for people who go to anxiety, that's for sure a thing. So the first thing that ISTDP really wants people to do is to help them to experience, like actually like have the total experience of your feeling,
Yeah.
you know, without having to block it off at all, and to let you could say like the pure feeling flow through you, which can be scary if you haven't done it in a long time. But when you actually experience it, you know, it's intense. So again, intense. It is intense because it's real feeling.
Oh yeah.
But it's not that bad. You know, there's something natural about it. You know, there's something satisfying about having the feeling and not blocking it.
And your feelings and being in touch with your feelings is the compass that guides you
Absolutely
towards living a fulfilling life in which you're living, you know, asserting your opinion, your truths, asserting yourself in relationship. Your opinions are the compass that guide you towards a fulfilling life.
Yeah.
So when people ask, you have to be aware that being in touch with your feelings is a requisite for wellness. I mean, would you agree with that?
100%.